Let us now go to visual diagnosis of the skin. The topic is dry skin. The most common cause of dry skin is liver blood deficiency. This is especially common in women. Liver yin and kidney yin deficiency are a common cause of dry skin in the elderly, and in some cases, dry skin may be due to stomach yin deficiency. A particular type of dry skin is due to chronic blood stasis. It results from the interaction and mutual exchange of blood and body fluids. Stagnant blood may impair the circulation of body fluids, and this may cause the skin to become dry. Dry skin from blood stasis occurs only in chronic cases when the blood stasis is severe, and it is very common in the elderly. It is fairly easy to distinguish between dry skin due to blood stasis and that due to yin or blood deficiency because in the former case, the skin is also dark and lacks luster, and the nails are often dark or purple and dry and withered. Apart from that, there will be some general symptoms and signs of blood stasis. In summary, dry skin may be due to liver blood deficiency, liver and kidney yin deficiency, stomach yin deficiency, or chronic blood stasis. For liver blood deficiency that is empty, there will be dry skin, dry hair, dizziness, blurred vision, floaters, numbness or tingling of limbs, scanty menstruation, dull pale complexion, a pale tongue with a pulse that is choppy or fine. The acupuncture points to be used are liver 8, stomach 36, spleen 6, and ren 4. For dry skin due to lung yin deficiency, there will also be thin hair, dry cough, weak voice, dry throat with a desire to sip water, hoarse voice, night sweating, tiredness, tongue without coating in the front, and a floating empty pulse. The acupuncture points to be used are lung 9, spleen 6, and ren 12. For dry skin due to kidney yin deficiency, there will also be dry hair, dry eyes, dizziness, tinnitus, hardness of hearing, poor memory, night sweating, dry mouth and throat at night, lower backache, constipation, dark scanty urine, tiredness, a normal colored tongue without coating, and a pulse that is floating empty. The acupuncture points to be used are kidney 3, ren 4, spleen 6, and ren 12. For dry skin due to liver yin deficiency, there will be dry hair, dry eyes, floaters in the eyes, blurred vision, dizziness, numbness or tingling of the limbs, scanty menstruation, dull pale complexion but with red cheekbones, withered and brittle nails, dry skin and hair, night sweating, normal colored tongue without coating, and a pulse that is fine or floating empty. The acupuncture points to be used are liver 8, stomach 36, spleen 6, and ren 4, with kidney 6. Dry skin with acute onset is due to lung dryness. There will be dry cough, dry throat, hoarse voice, and a dry tongue. The acupuncture points to be used are lung 9, spleen 6, ren 12, and kidney 6. Dry skin due to severe chronic blood stasis is a full condition. There will be dark face, dark rings under the eyes, abdominal pain, abdominal masses, painful periods, purple lips, purple tongue with a pulse that is wiry or choppy, and other symptoms will depend on the organ involved. Blood stasis causes dry skin only in severe and chronic cases. The acupuncture points to be used are bladder 17, spleen 10, and lung 9. For dry skin due to full heat, there will be red face, feeling of heat, thirst, mental restlessness, insomnia, with a tongue that is red with a dry yellow coating, and a pulse that is overflowing and rapid. Other symptoms and signs and the acupuncture points will depend on the organs involved. For dry skin due to empty heat, there will be scaly skin, malar flush, feeling of heat in the evening, thirst with a desire to drink in small sips, mental restlessness, 5-palm heat, night sweating, scanty dark urine, dry stools, and a tongue that is red without coating, and the pulse will be floating empty and rapid. Other symptoms and signs and acupuncture points will again depend on the organs involved. Dry skin with acute onset is due to wind dryness invading the lungs. There will be aversion to cold, fever, dry cough, dry throat, itchy throat, hoarse voice, sore throat, and a floating pulse. Dry skin due to wind in the skin will have itchiness, numbness or tingling of the limbs, skin eruptions that move around, they come and go quickly and affect the top part of the body. This is neither an external wind such as that seen in common colds and flu, nor an internal wind, but simply wind in the skin, a condition frequently seen in skin diseases. Liver blood deficiency with empty wind will cause chronic dry skin. There will be itchiness on the skin, scaly skin with white scales, slight tremor of the head and or the hand, facial tics, dizziness, blurred vision, unilateral numbness and or tingling of a limb, pale and thin tongue with choppy or fine and slightly wiry pulse. Thank you so much for your attention.